Greetings, my name is Candice Lindip, and in today's video we will be compiling a post-operative care chart for our cardiovascular patients. So first thing you need to know, your chart should include the type of surgery that our patient underwent. In this case, our patient had a coronary bypass. He might have had a heart transplant. He might have had the incision or the placement of a pacemaker. So we just need to know what surgery the patient underwent. Then we're going to include the personal data, height, weight, but in this case mainly the weight of our patient. This will guide us on how to treat our patient, such as diet, excretion and whatnot. Also, how our patient is being transported, mobility of our patient, and so forth. And also we need to be checking the consciousness of our patient. Is our patient unconscious? Is our patient semi-conscious, slightly conscious? We need to take note of this every 15 to 30 minutes. Then what you need to do is to check the vital signs. It is the most important part when examining our patient. You need to check your vital signs. We need to check pulse rate. Is it regular? Is it irregular? Is it slow? Is it weak? We need to take into account all this information. Then the respiratory rate. Irregular respiratory rate, which is below 12 and above 20. We need to check for blood pressure. In this case, at 7 a.m. our patient had 120 millimeters of mercury at 7 a.m. and it gradually decreased to the as we progressed into the afternoon. Right, and then questions that you want to ask our patient is, you want to ask the patient's name. This is if our patient is conscious. We want to ask the patient's name. We want to ask if the patient can hear us. We want to ask about any pain or discomfort that our patient might be feeling. We want to ask about chest pain, back pain, dyspnea. We need to ask all this information to know the further steps, or to know our next plan of action, or our next plan of action is. Then we need to check if our patient is coughing. If our patient is coughing, is the is the blood in the sputum, the color of it, the smell, the rate, its consistency, and the volume that is being excreted at a time. We need to check for leg edema. Leg edema, you can do this by estimating the pitting edema. This is where you will gently press onto the patient's skin, normally at the leg region, because we know this is a common area for the common site for edema for cardiovascular patients. We're going to gently press and then check the time of how the skin rebounds back to its initial position. We also want to check the temperature. The temperature, we want to check skin color. Is it pale? Is it blue? Is it normal? Having blue skin color indicates that the patient is not receiving enough oxygen to that region of the body. Is it pale, meaning that there is if it's pale, it means that there is no blood or flowing on the superficial part of on the superficial veins, or in the superficial veins. We want to check the patient's pulse oximeter. We want to check for wheezing, gasping, irregular breathing, and retractions for as we're examining our patient. Like I said, these are all vitals. These are all the basic things we need to find out before we further our treatment or our examinations, because anyway, thank you for listening. I hope you grasped some information as you were watching. Thank you.